Jobless claims go up again due to the coronavirus shutdown, with 6.6 million Americans filing first-time unemployment claims last week. So that brings the total over the past 3 weeks to more than 16 million Americans filing for unemployment. You could start seeing your stimulus check as early as today or tomorrow. However, the majority of deposits are expected next week. It all depends on whether the government has your bank information from your tax returns. And new at noon, the Federal Reserve just announced another massive cash infusion for the economy. $2.3 trillion will go to American households and businesses, as well as local governments. Under the Main Street Business Lending Program, loans would go to businesses with up to 10,000 employees. Now, on the flip side, Senate Democrats today blocked a Republican proposal to add $250 billion to the Small Business Relief Program. It would have helped business owners around the country pay workers that have been laid off because of the COVID-19 crisis. Here in Washington, Governor Inslee did roll out emergency funding for small businesses this week. Let's get a check on Wall Street right now. Stocks are up after the Fed's announcement. Right now, the Dow is up a little over 160 points right now, trading just above 23,000. The State Department of Health is now reporting almost 9,100 coronavirus cases in our state. That includes 421 deaths. The good news is more than 88,000 people have been tested, and just 8.7% of tests have come back positive. And now to some more good news. It is well known that Washington State was the first to encounter COVID-19 in the U.S., so it makes sense that we would be the first to emerge out of it. One ER director on the front lines told King 5's Jake Wittenberg there are signs of hope at hospitals.
Okay, so this is one of our capper carts.
Dr. Eric Shipley runs the ER at Overlake Hospital in Bellevue. It was at the center of the first outbreak of coronavirus in the U.S., but today he's delivering some welcome news.
So about 3 to 4 weeks ago, I was cautiously optimistic, and then now I'm much more optimistic.
Today, Shipley says ER volumes are down 30% at Overlake.
The initial tsunami kind of came, and we kept looking for that next wave, and you keep looking each day, and each day you don't see it, and you feel a little bit more confident. 4 weeks ago, we had 10 nursing homes with COVID-positive patients, and we expected every one of those to erupt, similar to what we saw in Kirkland, and we didn't see that.
He credits nursing homes with isolating COVID-19 patients quickly and preventing another major outbreak. Also, faster testing for the virus is making a big difference.
We went from 5 days of testing, which was brutal, to one 24-hour period, to now we actually have some testing for 2 hours and 45 minutes, which is such a big deal.
It may be hard for you to believe all the good news, but Dr. Shipley is just as surprised.
Even when I tell my neighbors that we're not busy, if you have serious illnesses, come, their answer is, no, I know you're busy. You're just not telling me. I saw it on the news and you're not telling me. And my answer is, no, trust me here. So I think Washington really should be both the model for predicting and the model for how do we exit from this storm.
UW researchers predict that we will hit our overall peak use of hospital resources at the end of this week. And although they downplayed the possibility of a second surge, they say they are prepared for that. And here's another sign that social distancing seems to be working. Governor Jay Inslee announced that this brand new field hospital that was just set up at CenturyLink Field is now being taken down so it can be redeployed to another state with a greater need. The CDC has loosened the rules to allow certain essential employees who have been exposed to the virus to return to work. NBC's Gabe Gutierrez has more on that, plus the latest on an improving but still dire situation in New York.
This morning, new signs from the White House Coronavirus Task Force that social distancing, in an effort to flatten the curve, is working.
Our data is telling us that mitigation is working. Keep your foot on the accelerator, because that's what's going to get us through this.
Saying the national death toll may not climb nearly as high as once projected.
That's what will change the mortality going forward.
The news comes as the CDC releases new guidelines for essential workers previously banned from going to work if they had been exposed to someone with the virus.
For individuals that have been within 6 feet of a confirmed case or a suspected case, and so that they can, under certain circumstances, they can go back to work if they're asymptomatic.
And even in the nation's epicenter, there's some encouraging news. Hospitalizations, ICU admissions, and intubations keep leveling off in New York.
We are flattening the curve because We are rigorous about social distancing.
But the news is not all good. The state of New York has more confirmed coronavirus cases than any country in the world. More than 150,000, 779 deaths in just 24 hours.
Psychologically, I just see the virus everywhere, so it's changed my life probably forever.
Essential workers have been devastated. Just a week after images like this frustrated many, subway cars packed due to reduced service, at least 41 transit workers have died and more than 1,500 have tested positive. And there are new hotspots, including Philadelphia, Washington, D.C., Detroit, Chicago, and New Orleans, where the convention center, retrofitted with 1,000 hospital beds, is now taking its first patients. Still, amid the heartbreak, triumph. Nurses and first responders erupting in cheers as this doctor was released from a hospital in New Jersey after spending a month battling COVID-19.
We will get through this. We will fight. We will wake up tomorrow morning again.
That was Gabe Gutierrez reporting. In New York and across the country, there are fears that warmer weather might lure more people outside. Public health officials can't say it enough. Now is not the time to stop social distancing.